Hello, and welcome to the world of families of children with club feet. My name is Eric Richard, and I have a vested interest in the treatment available for children born with club feet. I was born with this condition and underwent surgery when I was a child, and as a result, although the position of my feet was corrected, I consequently suffered with pain and discomfort for some years after. Although with the support of complementary therapies and acupuncture I was able to overcome this condition. But I'm delighted to let you know that now your child doesn't necessarily have to undergo surgery to correct their club feet. Time has moved on, and there's another treatment available now called the Ponseti method, which is much kinder to children's feet and has had fantastic results, a success rate of 95 to 98%. There are different treatments available for club feet, including surgery and the wearing of splints, but I, like many thousands of people throughout the world, believe that the Ponseti method is the best and most successful way of treating club feet. I do hope you will find this film interesting and helpful, and that you will take inspiration and hope from the children you are about to see. What is clubfoot? Well, an otherwise normal foot turns into a clubfoot during the second trimester of pregnancy. The foot is turned inwards and resembles a club, hence the name clubfoot. The condition is also often referred to by its medical name of talipes, or more properly, congenital talipes equinovarus, or CTEV for short. Clubfoot is often diagnosed on an ultrasound scan, although ultrasound cannot predict how severe the clubfoot is. There are many theories about the causes of clubfoot, but these are not conclusive. Many parents feel guilty when they find out their child has been diagnosed with clubfoot and wonder if they could have done something different to prevent the condition occurring. Parents should not feel guilty in any way. It's just one of those things that happens and needs to be dealt with. If your child has recently been diagnosed as having clubfoot, either during an ultrasound scan or at birth, you will obviously be concerned. However, I hope that this film will reassure you and show you how easily the condition can be successfully treated so that your child will lead a completely normal life. The Ponseti method of treating clubfoot was developed many years ago by a Spanish surgeon, now working in Iowa in the United States, Dr. Ignacio Ponseti. After a few years of operating on feet, he became convinced that surgery was the wrong approach for the treatment of clubfoot. Instead, Dr. Ponseti developed a method of gradually manipulating the foot into the right position over a few weeks, and then maintaining the correction by the wearing of a special brace. Treatment of clubfoot normally starts when the child is just a few days old. Firstly, the feet are examined to determine the severity of the clubfoot. It's important to remember that even the most severe, stiff clubfoot can be successfully treated using the Ponseti method. The practitioner will gently and expertly manipulate the foot towards a correct position. This position is held in place by the application of a plaster cast, which normally stays on for between 5 to 7 days. The child then returns to the hospital to have the cast removed, further manipulation, and another plaster cast fitted. This cycle continues for up to 8 weeks, depending on the severity of the clubfoot. You will be amazed each week as you look at the difference in your child's feet and the changing shapes of the plaster casts. As the foot is moved into the correct position, the ligaments are stretched and the foot becomes more flexible. Often, at the end of this series of plaster casts, a simple procedure called a tenotomy is carried out. This involves snipping the tendon at the back of the heel, which allows the foot to be more flexible when pointing up and down. This procedure takes seconds, and it may be performed under local or general anaesthetic. The foot is then put back in plaster for 3 weeks so that the tendon can regenerate. Parents are often worried about this part of the treatment if it's needed, but it's a very minor procedure. There are no stitches, and it can often be difficult to tell where the snip was made. After the last cast has come off, the foot has now been corrected, and I think this is fantastic. However, now comes what has been described as the hardest part of the treatment. This is when the continued care of the child's foot moves from the practitioner to the parents. It is really important to maintain the correction that has been achieved with the manipulations and plaster casts. So, in order to prevent a relapse, the child now has to wear a special foot brace, which is a pair of shoes attached to a metal bar. The brace, which holds the foot in an overcorrected position, has to be worn initially for 23 hours a day for 3 months. But after 3 months, in most cases, the time in the brace is reduced to between 12 and 14 hours, usually at night and during nap times. It may take a few days for you and your child to adjust to wearing the brace. There may even be some tears and sleepless nights initially, but this is short-lived. It is important that the brace is correctly and securely fitted. This will ensure that the correction is maintained and the risk of sores and blisters is reduced. Once children are used to wearing the brace, you will be astounded at how quickly they discover new and different ways of getting around. Children can sit up, crawl, and even walk in the brace. None of the milestones in their development are adversely affected. In fact, some parents claim that the brace strengthens their child's leg muscles and enables them to sit up more easily. During the time that your child is wearing the brace, you will encounter some practical issues. For example, your child may knock the bars on their cot at night and wake themselves up. All these issues can easily be overcome, and if you are in touch with other parents in the same situation, you can always share helpful tips with one another. Occasionally, some children will need a little more intervention at around the age of 3. This may involve moving the position of a tendon in the foot to make it pull in the right direction. This is not major surgery, but if required, it is an extremely successful procedure. So that's it. After 4 years, the brace can be discarded and your child's foot will remain corrected without the need for major surgery. There is no scar tissue, no reason to expect pain, arthritis or stiffness. Instead, your child can look forward to a completely normal life and probably won't even remember having had clubfoot. Here are some parents talking about their experience of living with the condition and their child being treated with the Ponseti method.
When I first found out that Thomas and William had club feet, I was scared, as any parent would be, worried about what this could mean to their long-term future. But within a few days of doing a little bit of research, talking to a few people, the consultant that discovered it through the scan, we felt a lot more reassured that there would be a positive outcome.
It was a big shock. I think I just wanted to have a baby that would be normal and active, and I did fear that he would be permanently disabled.
Yeah, we found out at the 20-week scan when we went to the doctors, and that Murad was affected with clubfoot. It was quite worrying initially, and obviously it took us about a week to sink in and started looking for treatments that needed to be carried out for this to get corrected.
I first found out about the Ponseti method on the internet. Initially, my consultant didn't even know about the Ponseti method of treatment. He just said that Lewis would probably need surgery. I didn't want to take this as the only option, so I took it on myself to go online, go onto the STEPS website, talk with other parents, and through research on the internet, that's when I found out about Ponseti.
Before Anthony was born, we were fearful for how we would react to seeing him with club feet. But immediately after he was born, we were just delighted with our lovely new baby.
The hardest part was probably following the application of a new plaster, because it can make them a little bit grouchy for about the 24 hours afterwards. Maybe the sleep's a little bit more disturbed, almost like they're a bit colicky, but that soon settles down, and by the time by a couple of days in, they've forgotten all about the new plaster and they're fine.
I think it's really important to not to wish your time away and always be looking ahead to the next stage of treatment. You really need to enjoy your baby, and they'll be having the treatment, but you know they're still a baby, and they're still, you know, it's not going to be the end of the world. It's really, you know, quite positive, and I think the joy of having a baby should really overcome a minor difficulty about having the club feet.
I want to reassure parents that their child would not miss out on any course of development during the upbringing and during the course of this treatment. As we have seen with our child, they walk at the same time as others, they would start crawling at the same time as others. So it's like any other normal child. This is just a treatment which is being carried out at the same time as their normal development.
Well, even though my brother had club feet, I still thought of him as a normal child, and most of my family did as well. I still played with him, we had fun together, and it didn't really get in the way of anything, so that was good.
Living with the condition hasn't been particularly hard. There's just been a number of minor nuisances, such as the practicalities of high chairs and having baths while the plaster casts are on.
The hardest part of the condition for me would be when people would stare at Lewis, especially when he was in his plaster cast, because they would look accusingly at me as if I'd thrown him down the stairs or something. In Boots and Bar the situation's a little bit better because they can obviously see that he's being treated, but initially that was probably the hardest part, being very protective over him as well.
The tenotomy wasn't a big problem really. We treated it pretty much like a normal casting. They'd been having casts every week. The main problem really was that they had to be starved for a few hours. They weren't allowed to have any feeds between 9 o'clock in the morning and then 1 o'clock in the afternoon, and they were getting pretty hungry. But we survived. A lot of finger sucking, a lot of walking around and cuddles, and they weren't too bad. And the actual tenotomy was really quick. They were back with me and screaming within 20 minutes.
My one piece of advice would be to make sure that the treatment is followed exactly as described by Dr Ponseti.
The hardest part of treatment would be when Lewis first went into his Boots and Bar from cast. In the cast, although he wasn't able to bend his knees, in Boots and Bar he can, but it was really hard. He cried a lot, and I did a lot of crying as well, so we cried together. But the important thing is to persevere. Don't give up. It only lasts 2 or 3 days, and work through it. And I mean, he's absolutely fine now, so just make sure you persevere.
What seemed at the beginning, for me, absolutely an insurmountable issue to deal with, both practically and emotionally, you do just get accustomed to it with time, definitely. And when I first came to this hospital, I was a very confident-looking woman walking around with a baby, and I thought, God, look at her, and I was just a gibbering wreck. And within 3 or 4 weeks, I was that confident person, I hope anyway, feeling quite okay about it, knowing what to expect. So if you just give it time, it does get to a situation where you can just deal with it quite happily.
Was living with a baby with their legs fully plastered as bad as you thought?
No. Once you get used to it, changing nappies is a bit fiddly to start with, and you have to adapt your clothing and your bedding and, you know, get the clump on the leg with the plaster cast and things, but no, it's no problem at all. Babies adapt to it better than we do. So.
I hope you found that interesting. If you're able, you will find it incredibly supportive to speak with other parents who are going through this experience. Here are some children who were born with clubfoot and being treated using the Ponseti method. I hope that by hearing their stories you will be assured that the method does work and that any worries you have about the treatment are laid to rest. Here we have Samuel, who's just 3 weeks old and started the Ponseti treatment 2 weeks ago. Samuel is coping well, and his parents are looking forward to the day in a few weeks' time when they will be able to cuddle their baby without the casts. Next we have Lewis, who is 3 months old. Lewis is currently wearing the brace for 23 hours a day. He has 2 months to go before the number of hours he spends wearing it is reduced. As you can see, he's perfectly happy wearing the brace and does not appear uncomfortable or in any distress at all. Anthony is 13 months and started the treatment when he was just 2 days old. He now wears the brace at night times only for approximately 14 hours. He can crawl and is just beginning to learn to walk on his own. Anthony's feet presented quite a challenge for his doctors. During the early stages of his treatment, it became evident that his feet were very stiff, short and puffy. Dr Ponseti calls this atypical clubfoot. As you can see, despite this, the Ponseti method has still worked and his feet look and function normally. Anthony can now walk quite happily and is in no discomfort at all. This is Raul, who is being treated in Spain. He was 2.5 years old when his treatment began. And this is Georgie, who is 8 and started the Ponseti method when she was 6.5. If you're trying to come to terms with your child having club feet, then I do hope this film has reassured you that they can be successfully treated using the Ponseti method. If you decide this is the treatment you want for your child, make sure you find a practitioner who is trained in this method. Speak to them and ask them all the questions you want or need answered to put your mind at rest. Also, try and speak to other parents who have gone through or who are going through the same experience. It can be a great source of support. At the end of the film, there is a list of support organisations and websites you can visit to gain more information. I, for one, am delighted that children no longer have to go through major surgery and suffer the pain and discomfort that I did. Instead, your children can look forward to a life with normal, pain-free and completely functional feet. How lucky they are. Goodbye and good luck.